Hello, my name is Jeanette. I'm 55 years old and I live and work as a professor for cardiogenetics in Lübeck, Germany. As a child, we learned that I have a muscle disorder without a given diagnosis. 10 years ago, I diagnosed myself using whole exome sequencing as a carrier of a sporadic, pathogenic glycine mutation in the collagen-VI gene. Mutations in COL6A2 as well as in COL6A1 and 3 cause collagen-VI muscular dystrophy, also referred to as Ullrich or Bethlen myopathy. COL6 CMD is rare with a broad spectrum of symptoms reaching from the mild form, known as Bethlen, to the severe form, known as Ullrich. COL6 CMD is considered as a spectrum disease, meaning that all kinds of in-between phenotypes are seen in patients. I consider myself as a classical in-between patient because I lost my ambulation only recently, but I'm on non-invasive ventilation during the night for more than 25 years. For 15 years, I'm a successful cardiogenetics researcher, and as this, I identified several risk genes for heart attack with my team at the Institute for Cardiogenetics at the University of Lübeck. 4 years ago, I started to establish a research group that aims to develop a therapy for Ullrich and Bethlen myopathy. 4 PhD and MD students, as well as my deputy and a technician, support the project with funding from the Deutsche Gesellschaft für Muskelkranke, QCMD, and the $1 Million Bike Ride Initiative. We have started to establish an RNA-based therapy concept for glycine mutations in the collagen-VI gene by using antisense and siRNA. In addition, we are working on an alternative approach using CRISPR interference and CRISPR-off to suppress the activity of regulatory elements of the collagen-VI gene to prevent the transcription of the mutant allele. Furthermore, we are currently establishing a zebrafish model for the disease in which we can test our therapy in the future and in which we can study the pleiotropic effect of collagen-VI to identify possible late onset risks in COL-CMD patients. Many thanks for your attention.